Hello and welcome to this Point of Care 101 activity titled HIV Updates for Pharmacy Practice, Maximizing Your Role to Impact Patient Outcomes. Part 1. The Pharmacist's Role in Rapid ART, Supporting Patients with Newly Diagnosed HIV.
Hello everyone and welcome to today's webinar activity. My name is Jason Schafer. I'm joined today by my friend and colleague, Dr. Jennifer Cocohoba. And so lots of evidence demonstrating here that when we get someone suppressed and undetectable, we can reduce the risk of transmission down to essentially zero. And with the initiation of antiretroviral therapy and these guideline recommendations to start as quickly as possible and the evidence that we have, we've seen an increase over time in the proportion of individuals in the United States with HIV who are virally suppressed. The suggestion is to start therapy as soon as possible, really, after diagnosis, and even as soon as the day of diagnosis, if it is possible.
For the individual patients, I think sometimes there's this reassurance that their HIV is going to be treated. I think there's, a little bit of a reduction of anxiety sometimes, that there's something you can do after a diagnosis with HIV.
If you were to start rapid ART, and we're talking kind of same day therapy or within 7 days of a diagnosis, it increased the probability for patients to just start therapy overall. It increased the likelihood of retention in care, but perhaps most importantly and most staggering here is that there was a decreased probability of death at 12 months as well compared to the standard of care. And so rapid ART can have significant benefits if done properly. So on the top portion of this chart are the regimens that you would recommend for rapid start. They include bictegravir at the top here, bictegravir plus tenofovir alafenamide and emtricitabine. Or you could use a dolutegravir regimen that has tenofovir alafenamide or tenofovir disoproxil plus either lamivudine or emtricitabine. And the third regimen that you have to choose here is darunavir. It's a protease inhibitor-based regimen. Thank you so much for your attention, your time today, and thank you, Dr. Cocohoba, for the conversation. I think it was a great one.